I'm very happy to be here today. I always like the opportunity to get some information out on various subjects, and I guess up north is with us. Are they there? Oh, hi. I want to be sure and get their questions if they have any as I'm speaking. And I'm going to cover several different things today. We're primarily going to talk about Medicare's low income subsidy or extra help, and senior RX and senior disability, and the SPAP, or the PAP, Pharmacist Assistance Programs. All of that's to help with cost of your Part D with your Medicare. We're not going into the major part of Medicare today. That's a whole nother ballgame. But we'll talk about the low income subsidy, and I'm going to find my clicker. Before I say too, I will mention that this little flyer has my number on the back. The bottom one is my number. And I'm with Aging and Disability Services of the division. I've been with the state for going on 10 years. Good, come on in. We're just starting. On the back of that, the bottom number is mine. And my name is Sharon, if you want to write it on there so it helps you remember.
Sharon, what did you say PAP stood for?
Oh, prescription pharmacy assistance program.
Program?
Turn this thing the way it goes, and let's see. Before we start, you should have a flyer. It's white. It says Medicare.gov at the top. 6. Yes. Sure. I don't know.
That's not me. I have nothing to do with it.
Are you talking about for the PowerPoint or for the video?
Yes.
Can you answer that?
If you move to just a little over.
They said it's way up in the corner for them to look at. Is there any way to move it?
No, that's where it has to
If
be.
you look in the upper left corner, that's what they see in you.
Right.
So if you're not
Oh,
in that box,
okay.
they don't see you.
Oh, I've gotcha. Okay, so if I move way over here, I'm out of your box. Okay. No, they said they can't change it. I'm sorry. Sorry, I'll try to stay in the box. That's pretty hard for me, but
PowerPoint and they can follow along.
okay, that's good. Okay, you've all found the white page, and it has 6 ways to lower your drug costs. I'm just going to give you some hints right now so that you can have this up here when it comes time. You can approach your physician to ask for generics, which are lower priced than your brand drugs, and sometimes they can help you with that. You can also look at your plan for your prescription D and find out if it has a mail order. And if you have your drugs mail ordered, you can sometimes get a 90-day supply at a reduced rate. And some of this will involve staying within the network of your pharmacies, which are with your particular drug plan, but it's one way that you might be able to lower costs. Another way is to choose a plan that offers extra help if you go into the donut hole. How many of you know what the donut hole is in Medicare? Okay, a few of you don't. I'll briefly explain it. It's a period of time when you and your prescription drug plan have paid for your drugs and reached a total payment of $3,310. When you've paid out that much for your drugs with your drug plan, the drug plan backs out and they don't pay anymore. It's all up to you. And you drop out of that donut hole when you reach $4,850. And at that point, then you are in what's called catastrophic period, and you only pay 5% for your drugs, which is very good. Now, I don't want to worry you because the majority of people never fall in the donut hole. It's primarily for people who are on expensive drugs or have a lot of drugs who fall in the donut hole.
Is that annually?
Yes, annually. And it changes from year to year. And if you don't remember anything else I said and you're on Medicare, please have your Medicare Part D drug plan checked annually. Because these pharmaceutical companies are independent companies who contract with Medicare and determine what they're going to be charging for the medications, for the premiums, and for the deductibles every year. And you may have a beautiful plan this year and you think, oh, this is great. I'm not paying that much in anything and the drugs aren't that expensive and I'm sticking. Well, that's wonderful, but next year, who knows? I know a drug plan that wanted Medicare to allow them to go up to increase their premium by 37%. And Medicare said, no way, you won't be contracted with us, so they ended up raising it 19%. So you need to check every year, and how can you do that? Well, if you're savvy online, you can go online to Medicare.gov, the plan finder, and check it all out. Otherwise, locally and probably up north, we have the Medicare SHIP program. And SHIP is free Medicare counseling, unbiased. And they will help you check your current plan, and they will help you find another plan that will be suitable for you. They don't make any decisions for you. They just show you your options that are best for you, and you pick. But it's all free. Sir?
On that Medicare drug plan search engine, can you look up private plans too, like
No,
Insures or something like that?
you have to go through them to find out what they're offering.
And is it SHIP?
It's capital S, it's an acronym, so it's all caps, SHIP. Stands for State Insurance Assistance Program, State Health Insurance Assistance Program. Now you have the Pharmaceutical Assistance Program. Sometimes, especially if you're lower income, the pharmaceutical companies will assist you in paying for your drugs a little bit, and that can be a big help. You need to call, let's say Pfizer, for example, is your pharmaceutical company, and you can call Pfizer, explain your situation, and ask them, do you have a patient assistance program? And they might be able to help you. Another way on here is Senior RX. Senior RX is above the low income subsidy or extra help in income. And if you can't make it, you can't get on LIS because your income and your resources are a little too high, you can then apply for Senior RX possibly. They don't look at your resources. They don't care what they are. They only look at your monthly income.
And that's for drugs?
And that's for drugs, but what it covers is if you fall into the donut hole, that's the big reason for trying to get it, it will cover your drugs at 100%. And that's major for anybody, but especially people of lower income. Ma'am?
Sharon, do you have to have Part D in order to get into Senior RX?
Yes, because that's how they're going to do primarily is cover things for Part D. They don't do anything else.
Part D, they take out $41 and change every month out of your Social Security.
Yes, and that's counted back in when they look at what your income is. Senior RX is not associated with Social Security or anything like that.
It's not.
No, it is an independent program. In fact, it's funded by tobacco settlement money. And if some of you who are older will remember when the tobacco companies got into a lot of trouble and there was big litigation, well, some of the money was given to the states, and that money in Nevada, a lot of it was determined that it should be used to help lower income people and help with prescription drug costs. And so we have Senior RX.
Does that qualify for an HMO?
Yes, you can have it with an HMO, as well as you can have the low income subsidy with an HMO.
Sharon, do you have a phone number for them?
I don't have it on here, and I don't have their flyer with me because they don't have it published yet. I talked to them yesterday, and they're in the process still of getting it printed. But if you call my office and call me at my number there, I can get it for you. It's on the back of that little square flyer. And they're up here if you lost it or you don't have one. For up north, you may not need my number, but here, I'll give it to you. It's 702-486-4581. And that's my office direct line. And as you can guess, I'm out a lot, but I always call back. So let's go on and start our little PowerPoint and talk about extra help, because this is the first thing you want to look at. We're going to talk about 3 different programs today. We're going to talk about the Medicare Extra Help. We're going to talk about a couple of workshops that are available for those with chronic diseases and caregivers chronic diseases, high blood pressure, diabetes, asthma, you name it, all of those things. And CarePro, which is, you may be familiar with being here, the Alzheimer's Association's program for those with dementia and Alzheimer's, the caregivers. And I will have some comments about caregivers when we get to that. It's a program description, and you're a target audience, and we'll talk about the qualifications. Now, I'll give you the background. LIS was the first name for the program. It was started in '03 with the Medicare Modernization Act, but it got lost because when that came out, Part D started. And that Part D went into effect in January '06. And boy, was that a big deal when we started getting prescription drugs with our Medicare program. And the low-income subsidy got lost in the shuffle. So in '08, they came out with their own program called MIPPA, capitals M-I-P-P-A. And it stands for Medicare Improvements for Patients and Providers Act. So that began in '08, and one of my duties, along with a corps of volunteers, is to find these people who can take advantage of the low-income subsidy. Now, years later, just several years ago, they started calling it the extra help. But you'll hear it both ways. It's absolutely the same program. It helps pay for Part D prescription drugs, premiums, deductibles, and copays. It's a very good program. There is a full LIS and a partial LIS. Now, if you don't qualify for Medicaid, this would be the next step. So if your income is too high for Medicaid, you need to look for LIS, extra help, because that's where then you can continue to get help with the premiums, deductibles, copays, and your costs for your drugs.
Excuse me. Do you know what the income level cutoff?
Yeah, we'll get to that.
Oh.
Yeah. If you have Medicaid or one of the Medicare savings plans, Quimby, Slimby, or QI, you should already have Medicaid. It comes with it. But they're very busy over there, and we as Medicare counselors have learned that sometimes someone is missed. So if you have applied or you know someone who has applied and they're not getting their payments, have them check with their caseworker or the team that is servicing them with Medicaid. Because it should be automatic, and then they can easily sign them up. Now, in order to qualify, besides the income level, you have to have Medicare Part A or B and live within the 50 United States. You don't have to have both, just one or the other. And here are the resources for 216. This would be gross, single person, or married couple. Are you seeing them okay up north? Yeah? Okay, that's good. So these are what, now, if you go to a Medicare counselor or you find one of my volunteers who's trained to do the LIS app, or you do it yourself, if you're a few dollars off, 100 or 200 off, go ahead and send it in anyway. The counselor will send it in for you anyway, because there are various things that they take into consideration when they determine your eligibility. So you don't know, and you don't want to miss it by a few dollars if there's a reason you should have it. Now,
If you own your own home,
does not count.
because it says resources.
Well, that's a resource, but they eliminate or don't count a few of them. They don't count your home. They don't count your car. They don't count if you have, they allow $1,500 for burial. If you're on SSI and you're owed back payments from Social Security, they don't count that money coming in as income. Yes?
Is it the net that we file on our income
Gross.
tax? It's gross.
Gross.
Okay.
It's a gross. So those things, personal belongings and things that are in your home, they don't count those either. Now, if you have an annuity,
Is that good or bad?
that's good,
Okay,
but they don't count those, sure. If you have an annuity and you have $100,000 in an annuity, but you're getting a very small amount monthly from it, they're not concerned about how much is in the annuity. They're strictly looking at your income from the annuity because you can't get at the rest anyway. It's what you get monthly from an annuity, and that question usually comes up because people put their money in annuities some. So you don't have to worry, it's based on what you take monthly from your annuity. Now, if you qualify, your generic medications can drop if you're full LIS to as low as $2.95. Now, you know what that means to anyone, and especially low-income people. That's a big drop. And your generics, special meds, $7.40. And those are the 216 figures that are out new. Now, you may have part of your monthly premium paid and your annual deductible. If you're full Medicaid, your deductible will be paid. Medicaid. If you're full LIS, your deductible will be paid. And if you're partial, they'll pay the deductible part of your premium. Now, with the premium, there's a little special thing that you need to be on what's called, if possible, a benchmark program, a benchmark plan for your drugs. And that the reason for that is there's no premium with it. There are 4 plans in Nevada that have a benchmark plan, 4 companies. And this benchmark plan is specific for people of low income, so they don't have the premium, and LIS will pay $56, where did it go? I think it's $56.40 toward the premium. Now, if it happens that you can't take one of those plans because you have meds that aren't covered, and you have to go on a regular plan, they'll still give you that $56, but you would have to pay the difference in whatever the premium is.
And what does LIS stand for?
Low income subsidy.
Low income?
Low income subsidy. Okay? And again, now the donut hole figures are there. As I mentioned, $3,310 to fall into the donut hole, where you would pay the whole thing, except if you have Senior RX or LIS, no donut hole. So both of those programs, there's no donut hole for you. And when you get out at $4,850, you're only going to be paying about 5% on your drugs. So, and if you have LIS, it's back to the $295 and $740.
I have a silly question on the income and resources. Does that include Social Security for the income, or is it?
Yes.
It does. Okay.
And it will ask for it on the application.
Thank you.
My number you can call the SHIP office. I'll give you their number. It's 702-486-3478. And that's the office that does the free Medicare counseling, and they do LIS apps as well. And you can do one of 2 things. If you only have a few meds, a couple meds, whatever, you can call them and say you need to have an appointment to talk on the telephone with a counselor. It can be done by phone. Or if you feel more comfortable going in, you can call and say, I would like to make an appointment to come in and sit with a counselor. Now they have 48 hours to get back to you. So you may not get a call right back. Jasmine?
Could you repeat the number?
Sure, it's 702-486-3478. And they do have a live operator. You can imagine she's busy, but they do have one.
Is there just one office?
Yes.
And where is that located?
It is on the corner, it's at 1860 East Sahara, and that's right on the corner of East Sahara and Burnham. And Burnham is one stoplight east of Eastern. So if you're going north and south on Eastern, you would turn west on Sahara, and it would be the corner of the first stoplight.
Thank you.
1860?
1860. Actually, the SHIP office is in the building in the back. There are several buildings there, and it's 1820. Actually, I'll just give you it's 1820 Suite 205. Now you know how to get there. This is an excellent program. It's easy to, now, a couple more things. You should have another sheet. Oh, that's a sheet that somehow didn't get here. Turn to this sheet. It's the other white sheet that has 10 things listed on it.
They do not have that sheet up north, let them know that.
Okay, I understand up north you don't have this sheet. I'm sorry about that. But you can get it from me if you need it, or I'll leave it here and you can chip it to them.
I can send it up.
That would be great. But I'll go over it quickly. It's kind of a review with a couple extra things. And this will be a,
Can I see that page?
It says Medicare Extra Help at the top.
It's all the way at the back.
Yes, thank you.
Everybody with me? Okay. In order to take advantage of the low-income subsidy, you must have Part A or B. Don't have to have both. You must live within the 50 states. Now, you can qualify for LIS if you're on Social Security disability and getting Medicare, meaning you've been on Social Security disability for 2 years, and the 25th month, they automatically get you into Medicare. So you could be 27 and have some sort of a disability that caused you to apply for Social Security disability and go on to Medicare after the 24 months. There's no penalty. Oh, well, let me stick to the thing. If you don't have a Part D, which we do run into people who don't have a Part D, you will randomly be given one by Medicare, or you can say, I'd rather go over to SHIP and have them help me find the plan. Because the plan that's going to come to you from Medicare is random, and it may or may not cover all of your meds. It may not be the lowest one available to you, it may not be a benchmark plan. So you can opt to go over to SHIP and have them help you find a plan if you don't have one. And some people don't have a plan.
I don't. I dropped Part D, so they gave me back the $41 a month in income, and I get all my drugs free.
Oh, okay.
RX Outreach.
Okay,
and
there
all
you
these
go.
other Places.
So that's
why-
wonderful.
Why would I want to have them give me a Part D Medicare and take $41 a month out of my
Well,
check?
there could be a possibility that you would have some sort of a catastrophe, whether it's some sort of a chronic damaging disease, or you were in an accident that caused all kinds of problems, and you needed to have more coverage than you were able to get where you're getting it now. And if they're not going to cover you to that extent, then you would definitely need a Part D.
But I could enroll at that point.
You can always enroll at the special time, but you're going to have a penalty for not having it during that period of time that you didn't have it. So you need to enroll in a Part D when you come on to Medicare, unless you're covered by your husband or wife's insurance, a company you're working for where they're covering you still for Medicare and Part B maybe. You don't have to worry. And when you leave that, the company should give you a letter that confirms that it was creditable coverage, so you can go out and get your Part D without any trouble. But if you do not pick up a Part D when you're eligible, you will have a penalty.
Does that change, I mean, so you do it every year, right?
Uh-huh.
So if you don't do it the first year, but you do it on year 4, do you still have a penalty?
You'll have a penalty, yeah. But if you pick it up, no, if you pick it up on Part 4,
Like during enrollment time, say.
Yeah.
say During enrollment time, can you change your coverage? during
yes,
enrollment
yes,
time
you
without
can do that.
penalty?
You can change it, and I'm trying to remember which one, and the girls up north may remember, somehow I'm a blank, whether it's Part A penalty or D penalty that follows you forever. I'm sorry, I've forgotten which one right now. But one of them is okay, you won't have it, and the other one follows you no matter what. But
When is enrollment time?
October 7th to December 15th every year right now, unless Medicare changes it.
October 7th to December?
15th,
Okay.
But coverage doesn't start until.
January. That's right, that's right. Okay, there are no open enrollment periods for LIS. You can sign up at any time. You don't have to wait for open enrollment or a special program on open enrollment. You can sign up any time. There are no penalties whatsoever of any kind, so you don't have to worry about that. that you were too late or you didn't do something you should have done, no penalties. No donut hole. And again, I already mentioned that you should already have it if you're on Medicaid or the Medicare savings programs or full Medicaid. And at the bottom, I've given you references where you can call to ask your questions. Everything's free, or get some help with applications if you decided you'd like to talk about it with someone. Okay? That's basically the low income subsidy along with senior RX, disability RX, and the SPAP programs, or the PAP programs, with the pharmaceutical programs where they give assistance. They don't all give assistance, but it's worth a call. If you need the help and you're taking their medication, give them a call. Any more questions right now? Uh-huh.
What is the option when you can't take a generic and they want to only supply you with a generic, that the generic doesn't
Your
work?
physician needs to take care of that for you.
Okay, and he has, but I'm just saying.
No, that's your
in these
option right there.
programs, will they issue a name brand in these programs?
Sure, you can always have a name brand, you'll just pay more. Like here, it's $740 instead of $295. But always check with your physician about what medication you're taking. Don't just assume that you can switch to, they're supposed to be the same, but you know what? You go through your physician. Yeah. Did you have a question?
Well, they just raised my deductible for my respiratory medications, $200 this year.
Sure.
So I opted not to get the medication. Is there any help I can get?
Go to SHIP and talk to SHIP.
Okay.
Yep.
I called the drug companies, but it turned out to be a wash.
This is our flyer for extra help. You'll see it around wherever you see that. You'll know that they're involved somehow with our extra help. Okay, now we're going to switch a minute to a couple other programs.
Would you let them know up north that that too is not a brochure that they have because those were ones you brought with you?
Yes.
So I'll send a packet up.
Okay. Up north, I brought some brochures, and she says that they're going to send them up to you. So don't worry that you don't have them, but you've got the PowerPoint, which will help you somewhat right now.
Yeah.
Okay. I've been involved, and the state has been involved with Stanford University's programs, a couple of them, and many of you may know that Stanford University is big on medical research. They do all kinds of research in different areas. And they came out with some programs some years ago that are national and international now. And I've been involved with those programs probably 5 years or so. And the first one is called Chronic Disease Self-Management. It's a 10-week workshop. It's free. It's for anyone with a chronic disease of any kind and caregivers. We've had couples come. I've taught the program about 7 times, and then I shift positions and what I'm doing. But I've done it enough to see the kind, and I'll give you a couple examples of things that happen to people who take this program. It's 10 weeks, 2.5 hours a week, always at the same location, same time. And it's offered by 2 agencies in town right now. It's offered, well, you're not offering it, you're giving it.
A 6-week healthier living.
Okay.
course. It's only 6 weeks, 2.5 hours a week.
There you go.
And one's in progress right now. The next one will be coming up in September.
Okay, be sure and look into that one because it's right here for you. And then this other one is offered by St. Rose, Dignity Health, or Nevada Senior Services. Both of those places offer the Chronic Disease Self-Management Workshop. And what do they do in the workshop, and what's it all about? We come together and we share if we like. There's no pressure, there's no homework basically. There is a wonderful book that many of the people who've taken it swear by the book. They just love it. We talk about, maybe share a little bit about some of the problems you're having with your chronic disease, relationships with families and friends, isolation, frustration, pain, fatigue, all kinds of issues that come along with having a chronic disease. There's a lot of brainstorming done where we put up what are the issues, and you talk about some of the things you've done to work with the issues. And then Stanford always has given us a list to be sure that certain issues are covered as we go through the program. I'm going to give you an example. And at the end of every lesson, everyone goes home with a task. And what we're supposed to do is figure out something you want to do for the week. It could be anything you want to do. It could be go to the movies. It could be wash the floor, take the dog for a walk. Some people have wanted to drink more water. They don't drink enough, so this is a good way to get yourself motivated. Exercise a little more. It could be anything. Talk to my wife more often. Go out to dinner with my wife a couple times this week. And we talk about when you're going to do it, how often you're going to do it, and how much time you're going to spend doing it for the week. And then when we come back the following week, everyone talks about how it went. There's no pressure, except certainly we're hoping everybody makes a little progress. Sometimes people don't. But then we do another one the next week. And lots of times on the evaluation, one of the things people have found the most helpful is that little activity that they've got themselves moving. They're up off the sofa. They were depressed because they were sitting there, no family, isolated wherever they live, watching TV all day and getting depressed. And they put on their little task that they were going to call a friend and make a luncheon appointment, or go to the movies, or be sure they went down to dinner instead of sitting in the home fixing, my sister once in a while, toast with peanut butter. And you know what? It worked. It helped them. It helped them with their depression. We talk about depression. How do you deal with it? How do you work with it? And what causes it to get worse with you? What are you doing that's letting it get worse? How could you combat it? All these things are talked about. I'm going to tell you a couple examples of things that happened in the classes. The last one I taught was at the Doolittle Senior Center. And a lady came in, and it was pretty obvious she'd had a stroke. She was paralyzed pretty much on one side, and her speech was very slow. And her appearance was that she was timid and maybe a little embarrassed about being there. And so I thought, you know what? I think this program's going to be able to help this lady. And it's so good that she came. That was the first thing. And people in there, as we talked, when she said she was hesitant to come, but she was there, people encouraged her. So we kind of learned from each other. We gained support from each other. And that lady came to every single session. And since there were a lot of things she couldn't really do, she said, you know, I glanced at the book before we started the course, and I'm going to read so many chapters of this book this next week. So that was perfect for her. She was interested in it, and you know what? She did it. And before this, and everybody supported her, you know, as everybody supported each other. And when the class was over, this lady had read the whole book. She was pleased with herself and happy with the information she'd learned. And everybody cheered her for having finished the book. And you know what? That lady came out of her shell. And she found out that she was just as acceptable as everyone else. Maybe she walked a little slower and her speech was a little slower, but there was nothing wrong with her up here. And she was much happier when she left the class. And they have a very active senior center there where we were teaching. And she ended up coming for the coffees on a couple times a week, and everybody greeted her. And you know, wonderful things happen. Another girl, probably in her late 40s, was in a wheelchair. And she'd been on her own. She'd had something happen that caused her to be in a wheelchair. Wasn't happy about it. And her sister was bringing her to our meetings. One of the lessons is on gratitude. You know, there's always a reason to have gratitude. And sometimes when we get stressed, no matter what the stressor is, we forget. And we sometimes forget that there are a lot of people worse off than we are. And we never think about it because we're busy with our own problems. So this class kind of wakes people up and gets them to thinking and sharing whatever. And this girl went home. She said that she was bitter. She went home and gave it some thought, and that was her task for that week. She said, I'm going to give some thought to this and work on this. She came back and she said, you know, in thinking about this, I realized that I have not been very grateful for things that have people and family who have helped me. I had to move out of my apartment because I couldn't live alone any longer, and I was angry. And my folks took me right in. My sister's helping me with getting places. They're doing everything for me, and I'm not even saying thank you. And she said, and I'm not doing anything around the house. And as I thought about it, I thought of some things I can do. I can put the silverware away because I can reach the dishwasher and the drawer. I can fold clothes. We fold our clothes. If they throw them on the bed near the edge, I can fold them and get it done for them. And she came up with a number of things she could do. And she had actually called a family meeting. And she said, you know what? I haven't been too likable. And I realize that. And I want to tell you, I'm sorry. And that family just was like this when that program was over. So I could tell you a lot of stories, but the main thing to tell you is it's free. It's 10 weeks. Call one of those places or talk to her about taking the one here, which is, what'd you say,
It's going to start in September, the next
Okay.
one. We've got one going on right now, but it's too deep in for them to.
Sure, okay. And this one you can't join after these, you can't join after the second week. So chronic disease is one I wanted to talk about, and the other one that goes with it, see we talk, here they are, arthritis, heart disease, stroke, lung, diabetes, and the caregivers. Had a couple came in, and it was obvious there was a little tension between them. They weren't talking very well. They shared, and the man shared, the husband shared, his wife had the cancer, the husband shared, I don't know what to do for her. We don't talk. I don't know what to say. I don't know how I can help her. And she's kind of in a shell and doesn't share with me. So it's very difficult, and we've kind of grown apart because there's nothing going on between us. And I feel so bad and I worry. Well, his wife never realized how much he silently worried about her, and more so because he didn't know what to do to help her. Well, they started talking in this program, and they heard all the different sessions and all about what went on and what they learned. And when they went out, those two were arm in arm, and they were laughing. And you know what? Their relationship had been reestablished, and things, I'm sure, were going to go much better. So those are the reasons to attend. Caregivers as well. Had it turned the wrong way. We build self-confidence and helping to maintain themselves and their health, and they're managing their chronic condition. And here we go. Techniques to deal with frustration. You can read fatigue, pain, isolation. Exercise, we talk about better breathing and sleep, how to help yourself sleep better. Use of medications, meaning how do you remember to take them? What are some things you can do? And we brainstorm some of that, and everybody gives their ideas, how they manage to remember to take them. How to talk with your doctor about your medications if you're concerned that something isn't working quite right. Healthy eating and nutrition, we talk about that. Communication with family and health professionals. How do you talk to your doctor? How do you get him to answer your questions? We give out ideas. We all share about that. And again, it was Stanford University studied it for 3 years, and it has become evidence-based, which means it's tried and true and accepted all over. And as I said, it's now an international program. Another program I'm not going to go into, I'm just going to tell you it exists, is also out of Stanford, and it is for diabetics and caregivers. It's called Diabetes Self-Management, and you have a flyer on it. And it's offered by the same two programs, St. Rose Dignity Health and Nevada Senior Services. The phone numbers are here. And on this flyer, the one from Dignity Health, that number is on the flyer. And I'm not sure about the other flyer, if it's on there or not, for Nevada Senior Services. However, if you turn the Nevada Senior Services flyer over, it's at the top of that one, the 648 number. And as all you do is call and say when and where are you having a program, and lots of times you can wait and find one that's near where you live. At least it's close enough.
Do they offer them up north as well?
Yes. Yep. Now, the last program I'm going to talk about, really anything at all in depth, is how much time do I have? Oh, good. Perfect. Is CarePro and EPIC, they call it. This is out of the Alzheimer's Association, CarePro. This program, you know, caregivers have been forgotten for way too long. Caregivers suffer, they have stress, they neglect themselves, they become ill. CarePro. White.
I don't have that.
This program is for caregivers only. It's 10 weeks long, but you have 1 week in a group, and the alternate week is a coach call from home. The coach will call you and talk about your particular situation. How are things going? Are you using any of the techniques that we've taught? What kinds of things do you need? And then the next week you go back and there's always professionals giving the presentations. And what do you learn and how does it help caregivers? Caregivers are stressed and many times caught off guard and really don't know where to turn. And they start out by teaching you about the disease. Where are we with it? What's the research on it? What all's happening with it? What is it? And then they start out with like, what can you expect? What kind of changes will you see? What things we know happen to most people who have either, it could also be severe dementia. Doesn't have to be diagnosed necessarily as Alzheimer's. And then they give you techniques, how to deal with some of these things that will happen. And all the while, how do you deal with your own stress? And one of the other main programs is taking care of you. Because that's one of the most difficult things with dementia and Alzheimer's is for the caregiver to take care of themselves. And I'll give you a personal example, and this is classic. It's what I would tell you about, except it happened in my own family. My brother-in-law was born and raised in San Diego, and he was a dentist. He loved it. I thought he was an excellent dentist, and he loved it so much. And when he was older, he was diagnosed with Alzheimer's. My sister, of course, was his caregiver. Their kids were grown. One's in Maryland and one's in Northern California. Well, at the time it happened, the daughter was still at home, so she could help out. She was teaching. And after about 4 years, they were ready that it was time that he would have to go into a home where they had the professional help to care for him. At that very time, my sister had a heart attack and died. And the doctor said she wasn't on any medications, nothing was notably wrong with her. He said it was stress from caring for my brother-in-law. And he lived 13 years. And an average, they say, is 10. And he lived 13 years. She wasn't able to cope with the stress. She neglected her own appointments. She neglected, obligations she had that had to go by the by, and that stressed her as well. This is something major not to be fooled with or ignored, because you know how prevalent Alzheimer's and dementia is right now, and it's growing. It's happening more and more drastically fast. So this workshop, covering the things that it does, is wonderful to help. And the stress and teaching you how to deal with things and remember yourself is a major part of it, besides just learning about techniques. I'll tell you,
We also have a caregiver class here in this center. When I took this class, it was very good. Covered a lot of things, how to take care of yourself and the person you're taking care of. And the thing that I enjoyed most was the soft sort of approach of communication. They call it a keto communication. It's very much like a service, but with a light, gentle quality to it.
That's right, yes, and that is important too. Just how you approach someone with Alzheimer's is important, because they are not going to recognize you at a certain point, and they're not going to know who you are, and you forget, and you come in and, hi, I'm your long-lost niece. Well, scare them half to death. They don't know who you are. Approach makes a lot of difference. So I'm glad you took the class, and I'm glad you enjoyed it and can say that it was worthwhile.
And there was no final exam either.
No? That's right. I'll tell you a quick one that's easy. A lady used to be sales clerk in a ladies' ready-wear, and she was a wonderful, nice lady, and I knew her quite well. And she was diagnosed with Alzheimer's. She lived with her daughter and son-in-law. And everything was going along fine. And one day, out of the blue, this is how things just changed. The daughter went out shopping, and the son-in-law was at home, and he decided to go out in the yard and do some gardening. And that was all fine, and the mother-in-law was in the house, and she was fine. And when he went to come back in, she locked him out.
She what?
She locked him out. Well, he didn't have a key to get in. And she wouldn't let him in. No, you're not coming in. He waited 2.5 hours until his wife came home to let him in the house. So then they had a tete-a-tete and said, okay, what are we going to do here? Because it's going to happen, apparently. So it was easy. That one, he put a key on his belt loop and always had his key with him. But sure enough, the next time he went out, she locked him out. She didn't care if he came back in. It was never an issue. It was just once he was out, that was it. So you never know. Some things are easier and some things are very difficult to manage. So you have to learn how to manage yourself and your stress. And this program is excellent for this. Now there's a new program, it's only a couple years old. It's also through the Alzheimer's Association. It's called EPIC. And don't ask me, oh, here it is. Easy Stage Partners in Care. Early stage, I'm sorry, you're right. This is a new program primarily for newly diagnosed people. Now when you go to the other program, they're looking for some caregivers who have been in this a while with whomever they're caring for, and their stress level has risen. And there'll be a telephone interview, and they'll determine whether you are at the level that this course could be good for you. And some people are denied and said, come back a little later when, the stress is worse and you're having more problems. This one is for the more newly diagnosed, and both parties can come, the caregiver and the one diagnosed. And it's an initial introduction to everything to help them get organized, realize what's happening, and become aware of what they're going to experience and what to do. Has anyone had the program here? I thought you might have. What did you think?
It was good, and it was good networking with other couples as well.
That was good too. And then I might mention in all of these programs, the networking and sharing with the others with the same issues is quite helpful.
Is it in other states as well?
I don't know about this one because it's not evidence-based yet. And I'll explain something to you about me so you know why there's hesitancy here and there. I've been with the state almost 10 years, and I was a Medicare counselor trainer and outreach volunteer coordinator with CHIP for 5 years. So I really believe in CHIP. I know about CHIP. And then I was asked to move into another department. And I've been working with aging and disability for 4 years. And that's doing the LIS apps and working with all these programs. Then I'm grant funded. The grant money ran out. And so I resigned and volunteered for a little while. And apparently they got grant money back. And one day my ex-supervisor called and said, how would you like your job back, your old job? And I said, I love my job, sure. So during the time I was gone, which was almost a year, this program became more known. And I've had one presentation on it, which it goes right in line with CarePro. But to give you more of the specifics on it, I can't at this moment, except to tell you this lady has taken it, and others who I have talked to about it have taken it, and they thought it was very beneficial. And it's good to have something for the newly diagnosed, so that you're not panicked out like some of these people who apply for CarePro and they're not quite there yet where they need to be. It's kind of scary to have someone say, well, come back, later. Anyway, they're wonderful programs. And the last flyer, I'm going to use every minute here, is from Nevada Senior Services. And the reason I just present the flyer to you is to tell you that Nevada Senior Services has become an ADRC, Aging and Disability Resource Center, and they're reaching out to 4 counties now with this information. They have, if you look at the back, a number of services that are available. So I'm giving it to you as a very good resource. It's a very respected program. You can see the ramp situation. They have a licensed contractor who works with them. And this contractor can go out if someone's building a new home and they have to have some disability fixtures in there for the disabled, and work with them and help them know what they need to do. Or if you want to remodel or you need some new things like, say, a ramp, the contractor will come out, look at the situation, and help you organize what you need to do. That's a little more than other programs can do sometimes because they don't have a contractor. The GAP program, that is for elderly, 60 years old, I believe, and it's a complete geriatric medical assessment and social assessment. If you have someone you're concerned about, you can take them there. It's free, and they will have a medical doctor there, will do all the tests you can think of, a social worker who will talk to you about your social setting, your family, all these things, get a good, well-rounded picture of your situation, and then all of that information will go to the primary physician, whoever your primary physician is. Respite care is available. The care consultation is on the front. They mentioned benefits counseling, caregiver support. Care consultation is a wonderful program for caregivers. You can call in there and say, I'm really confused about this or having a problem about this, and this is for the whole state, by the way. And this gal can help you set goals, help you find resources, discuss your stress and help you with that. And it can be ongoing for up to a year, where you go along fine, you get her assistance, everything's going well, and 2 months down the road you think, oh, I need to talk to this gal. Her name is Celeste. And she'll talk to you again, and maybe you need to reset some goals, whatever, and she'll help you look at everything that you need, and you go forward. So it's not an ongoing daily thing, but it can last up to a year. So they have some excellent programs there. And as I am looking for volunteers always, my volunteers do the things they enjoy, like doing health fairs for us and just having the information available and presenting, becoming a low-income MIPA, low-income subsidy volunteer, doing applications. And they can even be done from home. I have one volunteer who works from her home because she works all day. 6 o'clock in the evening, she takes calls and helps people online. Oh, these applications are available online at socialsecurity.gov and at benefitscheckup.org. Those are 2 places you can go to find the app online.
What was that again,
Benefitscheckup, all one thing, .org, or socialsecurity.gov. So I urge you to keep this at hand in case something comes up, especially if you're a caregiver, so that you'll have resources you can talk to or people who can help you find resources. And this care consultation gal can do just that. Any questions? We've covered quite a bit, and I didn't finish going through the end of Care Pro, but I pretty much discussed it with you.
Actually, it's 2 comments, but I think I have found great value in the caregiver support group that meets here.
Good.
Every Wednesday, one
Good.
break.
Okay,
And I've gotten more information there, and it's free.
good. Every Wednesday at what time?
1:15.
Okay, so there you are, caregiver support right here where you are today. You know how to get here. Every Wednesday at 1:15, right here. Any other questions? Well, I want to thank the LouRuvo Center for Brain Health for inviting me today, Jasmine for having me come, and you've got my number, and I wish you all well.
Thank you, Sharon.